A Nurse Career Guide. Chapter 1. The Nursing Profession. Nursing Career Info. Registered nurses attend to patients' physical, mental, and social well-being in hospitals, schools, private clinics, workplaces and in patients' homes. They are advocates for patient care. Registered nurses are licensed to practice by completing a board-approved nursing program, typically by receiving a BSN and passing the NCLEX exam, a national licensing examination, that is administered by each state. Advanced practice nurses. Nurse practitioners are registered nurses with advanced clinical experience and graduate education training. They typically receive a master's degree upon completion and choose to specialize in adult health, family health, school health, pediatric health, gerontological health, or acute care. Other advanced practice areas include certified nurse midwife, registered nurse anesthetist, clinical nurse specialist and public health nursing. Nurse practitioners can provide basic medical services such as routine physical examinations, treat illnesses and may prescribe medication. As more registered nurses pursue higher education, receive advanced degrees and gain advanced clinical experience, they also pursue management and administrative roles to work as nursing administrators, consultants, attorneys, educators, or researchers. Doctors have the Hippocratic Oath, nurses have the Nying Ali Pledge after the famous nurse Florence Nightingale. Nursing is not a way to get rich or an average job. It takes guts and compassion to be with sick people all the time. If you go to stats.bls.gov, you'll see nursing topping the list for job growth. It's not just that, it's flexibility. There are several dozen types of nurses and many different types of institutions and countries you can work in. If you want job security, be a nurse, particularly a gerontological nurse because nursing homes are full and understaffed. If you don't have the time or the smarts, start off as a nursing aide. Go from there. You can work and taking nursing courses online. You have to take blood with needles and see a lot of physical carnage. For some people like old and disabled people, you have to put a bedpan under them, remove their poop then clean their butts. You can start a nursing aide, move on to nurse or start as a nurse and move on to doctor. You can read a more in-depth version of this article at bls.gov/ocos/ocos083.htm bls.gov/ocos/ocos102.htm. Nursing programs are generally 2-year associate degree in nursing programs at nursing school or community college and 4-year Bachelor of Science in Nursing/BSN programs at college. Some of the subspecialties are hospital, office with doctors, etc. Nursing home, home health/private duty, public health, occupational health, nurse administrators, nurse supervisors. Advanced nurses are nurse practitioners, clinical nurse specialists, certified registered nurse anesthetists and certified nurse midwives. Nurse practitioners can write prescriptions in all 50 states. One step below full-fledged nurse is the licensed practical nurse, someone who cares for sick and elderly people in a less stringent manner than registered nurses. These programs are generally about a year long. Considered one of the most stable occupations around, you can easily get a job anywhere if you want, or you can sign up with a medical employment agency and do temporary stints all over. If you want to take a few months off, quit your job and easily find another when you're ready. However, on the downside, it can be dirty work. Working with babies might be fun, but when you have to change bedpans and wash people, you might regret your job. Pick a subspecialty in something you like. Many nurses meet their spouses on the job because it's so public. Registered nurses, RNs, handle a variety of tasks related to both health and illness. Typically concerned with the whole person, registered nurses deal with patients' mental and emotional functioning as well as their physical needs. Hospital nurses constitute by far the largest group of nurses. Most are staff nurses who provide skilled bedside nursing care and carry out the medical regimen prescribed by physicians. They may also supervise licensed practical nurses, aides and orderlies. Hospital nurses usually work with groups of patients who require similar nursing care. For instance, some nurses work with patients who have had surgery, others care for children, the elderly or the mentally ill. Registered nurses working in nursing homes provide bedside nursing care to patients convalescing from surgery or an illness and to those suffering from chronic illnesses and disabilities. They also supervise licensed practical nurses and nursing aides. Private duty nurses give individual care to patients who need constant attention. They may work in a home, a hospital, or a nursing home or rehabilitation center. Community health nurses care for patients in clinics, schools, retirement and life care communities and other community settings. A growing number provide home health care. They instruct patients and families in health care and give periodic care as prescribed by a physician. They may instruct community groups in proper nutrition and exercise and arrange for immunizations, blood pressure testing and other health screening measures. These nurses work with community leaders, teachers, parents, and physicians in community health education. Some community health nurses work in schools. Office nurses assist physicians, dental surgeons and, occasionally, dentists in private practice, clinic, and health maintenance organizations. Sometimes they perform routine laboratory and office work in addition to their nursing duties. Occupational health or industrial nurses provide nursing care to employees in industry and government and, along with physicians, promote employee health. As prescribed by a doctor, they treat minor injuries and illnesses at work, provide needed nursing care, arrange for further medical care if necessary and offer health counseling. They may also assist with health examinations and inoculations. To obtain the license to practice that is required by all states and the District of Columbia, nurses must graduate from an approved school of nursing and pass a national examination administered by each state. Nurses may be licensed in more than one state, either by examination or endorsement of a license issued by another state. Some states require continuing education for license renewal. Nursing training programs vary in length from 2 to 5 years after graduation from high school, depending on the nature of the program. Programs offered by community and junior colleges take about 2 years and lead to an associate degree. Hospital-based programs last 3 years and lead to a diploma. College and university programs require 4 or 5 years and lead to a baccalaureate degree. Persons who want to pursue a nursing career should have a sincere desire to serve humanity and be sympathetic to the needs of others. Nurse anesthetists complete a certificate program allowing them to administer anesthesia under the direction of a physician. Nurse practitioners and nurse midwives have graduate-level training in diagnostic and health assessment skills that enables them to perform certain duties normally performed by a physician. Clinical nurse specialists and nurse clinicians have expertise in a clinical area such as pediatrics or gerontology/geriatrics, which usually is obtained through completion of a master's degree program. The National League for Nursing, NLN.org, publishes a variety of nursing and nursing education materials, including a list of approved schools of nursing and information on student financial aid. Books about nursing are at #610.73 or RT41 at the library. Types of nurses/nurse specialties. Some types of nurses are as follows. Type the term into a search engine. Abuse prevention and treatment nurse. Ambulatory care nurse. Apheresis nurse. Burn care nurse. Cardiac care nurse. Case management nurse. Community health nurse. Complementary health nurse. Correctional facility nurse. Critical care nurse. Dermatology nurse. Developmental disability nurse. Diabetic nursing educator. Emergency department nurse. Endocrine nurse. Environmental health nurse. Family nurse practitioner. Flight nurse. Forensics nurse. Gastroenterology nurse. Genetics nurse. Geriatric nurse. Gerontological nurse practitioner. Gynecology/obstetric nurse. Head and neck nurse. Health policy nurse. Hematology nurse. HIV/AIDS nurse. Home health care nurse. Hospice nurse. Infection control nurse. Infusion nurse. Lactation consultant. Legal nurse consultant. Long-term care nurse. Managed care nurse. Medical surgical nurse. Midwife. Military nurse. Neonatal intensive care nurse. Nephrology nurse. Neuroscience nurse. Nurse advocate. Nurse anesthetist. Nurse. Attorney. Nurse executive. Nursing administrator. Nursing educator. Occupational health nurse. Oncology nurse. Operating room nurse. Ophthalmic nurse. Orthopedic nurse. Outreach nurse. Pediatric nurse. Pediatric nurse practitioner. Plastic surgery nurse. Psychiatric nurse. Psychiatric nurse practitioner. Pulmonary care nurse. Radiology nurse. Rehabilitation nurse. Research nurse. School nurse. Subacute nurse. Substance abuse nurse. Summer camp nurse. Surgical nurse. Telemetry nurse. Telephone triage nurse. Transcultural nurse. Transplant nurse. Travel nurse. Urology nurse. Women's health nurse. Wound and ostomy nurse. Articles on nursing school and a nursing career at nursing.jnj.com. There is info on financial aid and scholarships. Chapter 2. Nurse info mostly from careerprofiles.info. An article and types of nurses at careerprofiles.info/nursingcareers.html. Learn how to pass the NCLEX exam. There are jobs for nurse educators and teachers at colleges and hospitals. Here are places that nurses work. Hospitals and general medical. Doctors' offices. Home health companies. Nurse care facilities. Outpatient care centers. Most nurses work in these states: California, Texas, New York, Florida, Pennsylvania. Location determines salary. In some states, the average wage is about half of other states. Nurse occupation education requirements. Clinical nurse specialist BSN, MSN, and/or CNS certificate. Nurse anesthetist BSN, MSN in nurse anesthesia. Nurse educator BSN, MSN, preferred. Nurse midwife BSN and CNM certified. Nurse practitioner BSN, MSN, doctorate, DNP, preferred. Nurse researcher BSN, MSN, Ph.D. Occupational health nurse ADN or BSN. Pediatric nurse ADN or BSN, MSN with oncology specialization. Public health nurse ADN, BSN, or MSN, preferred. Registered nurse, RN, diploma, ADN, or BSN. Vocational/licensed practical nurse diploma. Critical care nurse ADN or BSN, CCRN certificate. Emergency nurse diploma, ADN, or BSN, preferred. Hospice/palliative care nurse ADN or BSN, preferred, palliative care cert. Labor and delivery nurse diploma, ADN, or BSN, preferred, neonatal cert. Neonatal nurse BSN, neonatal training. Nephrology nurse ADN, BSN, or MSN, preferred. Nurse executive BSN, MSN, doctorate, preferred. Oncology nurse ADN or BSN, MSN with oncology training. Orthopedic nurse diploma, ADN, or BSN, preferred, and ONCB certification. Perioperative, OR, nurse ADN or BSN. Psychiatric mental health nurse BSN and MSN. School nurse BSN and school nurse certificate. Staff nurse ADN or BSN. Nursing degrees are: Diploma in Nursing, LPN degree, LPN to RN. Associate degree in Nursing, ADN/ASN. LPNTO BSN. Bachelor's Degree in Nursing, BS/BSN. RNTO BSN. Accelerated Bachelor's in Nursing Degree, BSN. Masters of Science in Nursing, MSN. RNTO MSN. Doctor of Nursing, DNP. Doctor of Nursing Science, DNSC, DNS, or DSN. PhD/doctoral nursing degree. In the United States, accreditation for nursing schools and programs are provided by two organizations. The Commission on Collegiate Nursing Education, CCNE. The National League for Nursing Accrediting Commission, NLNAC. The American College of Nurse Midwives Division of Accreditation, ACNM, evaluates and accredits midwifery programs. The Council on Accreditation of Nurse Anesthesia Educational Programs, COA, accredits nurse anesthesia programs. Being approved by a state board of nursing is not the same as being accredited. A school or program that has been approved by the state is licensed to prepare nursing students for the National Council Licensure Examination for Registered Nurses, NCLEX. It does not mean that the school has been evaluated by an accrediting committee and met certain standards. Nursing career specialties. Advanced practice nurse. Ambulatory care nurse. Camp nurse. Cardiac care nurse. Cardiac cath lab nurse. Case management nurse. Clinical nurse leader. Community health nurse. Complementary health nurse. Correctional facility nurse. Dermatology nurse. Developmental disability nurse. Diabetes nurse. Domestic violence nurse. Ethics nurse. Family nurse practitioner. Flight/transport nurse. Forensic nurse. Gastroenterology nurse. Genetics nurse. Geriatric/gerontological nurse. Gerontological nurse practitioner. Gynecology/obstetric nurse. Health policy nurse. Hematology nurse. Holistic nurse. Home health care nurse. Independent nurse contractor. Infection control nurse. Informatics nurse. Infusion nurse. Lactation consultant. Legal nurse consultant. Life care planning nurse. Long-term care nurse. Managed care nurse. Medical surgical nurse. Military and uniformed service nurse. Neonatal intensive care nurse. Neuroscience nurse. Nurse attorney. Nurse legislator. Nursing. Manager/administrator. Ophthalmic nurse. Otorhinolaryngology nurse. Pain management nurse. Pediatric endocrinology nurse. Perianesthesia nurse. Perinatal nurse. Plastic surgery nurse. Psychiatric nurse practitioner. Pulmonary care nurse. Quality improvement nurse. Radiology nurse. Rehabilitation nurse. Reproductive nurse. Rheumatology nurse. Rural nurse. Subacute nurse. Substance abuse nurse. Supplemental/agency nurse. Surgical nurse. Telemetry nurse. Telephone triage nurse. Toxicology nurse. Transcultural nurse. Transplant nurse. Trauma nurse. Triage nurse. Urologic nurse. Veterans Affairs nurse. Wound and ostomy nurse. An article on nurse specialties at careercornerstone.org/nurse/nurseareas.htm. RNs can specialize in one or more areas of patient care. There generally are 4 ways to specialize. A particular setting or type of treatment, such as perioperative nurses. Health conditions, as do diabetes management nurses. Working with one or more organs or body system types, such as dermatology nurses. A population such as geriatric nurses, who work with the elderly. Some RNs combine specialties. Ambulatory care nurses provide preventive care and treat patients with a variety of illnesses and injuries. Some ambulatory care nurses are involved in telehealth, providing care and advice through video conferencing, the internet, or by telephone. Critical care nurses provide care to patients with serious, complex, and acute illnesses or injuries that require very close monitoring and extensive medication protocols and therapies. Critical care nurses often work in critical or intensive care hospital units. Emergency, or trauma, nurses work in hospital or standalone emergency departments, providing initial assessments and care for patients with life-threatening conditions. Holistic nurses provide care such as acupuncture, massage, and aromatherapy and biofeedback. Home healthcare nurses provide at-home nursing care for patients. Hospice and palliative care nurses provide care, focused on maintaining quality of life for terminally ill patients. Infusion nurses administer medications, fluids, and blood to patients through injections into patients' veins. Long-term care nurses provide healthcare services on a recurring basis to patients with chronic physical or mental disorders, often in long-term care or skilled nursing facilities. Medical surgical nurses provide health promotion and basic medical care to patients with various medical and surgical diagnoses. Occupational health nurses seek to prevent job-related injuries and illnesses, provide monitoring and emergency care services, and help employers implement health and safety standards. Perianesthesia nurses provide preoperative and postoperative care to patients undergoing anesthesia during surgery or other procedure. Perioperative nurses assist surgeons by selecting and handling instruments, controlling bleeding and suturing incisions. Psychiatric mental health nurses treat patients with personality and mood disorders. Radiology nurses provide care to patients undergoing diagnostic radiation procedures such as ultrasounds, magnetic resonance imaging, and radiation therapy for oncology diagnoses. Rehabilitation nurses care for patients with temporary and permanent disabilities. Transplant nurses care for both transplant recipients and living donors and monitor signs of organ rejection. Addictions nurses care for patients seeking help with alcohol, drug, tobacco, and other addictions. Intellectual and developmental disabilities nurses provide care for patients with physical, mental, or behavioral disabilities. Care may include help with feeding, controlling bodily functions, sitting or standing independently, and speaking or other communication. Diabetes management nurses help diabetics to manage their disease by teaching them proper nutrition and showing them how to test blood sugar levels and administer insulin injections. Genetics nurses provide early detection screenings, counseling and treatment of patients with genetic disorders, including cystic fibrosis and Huntington's disease. HIV/AIDS nurses care for patients diagnosed with HIV and AIDS. Oncology nurses care for patients with various types of cancer and may assist in the administration of radiation and chemotherapies and follow-up monitoring. Wound, ostomy and continence nurses treat patients with wounds caused by traumatic injury, ulcers, or arterial disease. Cardiovascular nurses treat patients with coronary heart disease and those who have had heart surgery, providing services such as postoperative rehabilitation. Dermatology nurses treat patients with disorders of the skin, such as skin cancer and psoriasis. Gastroenterology nurses treat patients with digestive and intestinal disorders, including ulcers, acid reflux disease, and abdominal bleeding. Gynecology nurses provide care to women with disorders of the reproductive system, including endometriosis, cancer, and sexually transmitted diseases. Nephrology nurses care for patients with kidney disease caused by diabetes, hypertension, or substance abuse. Neuroscience nurses care for patients with dysfunctions of the nervous system, including brain and spinal cord injuries and seizures. Ophthalmic nurses provide care to patients with disorders of the eyes, including blindness and glaucoma, and to patients undergoing eye surgery. Orthopedic nurses care for patients with muscular and skeletal problems, including arthritis, bone fractures, and muscular dystrophy. Otorhinolaryngology nurses care for patients with ear, nose, and throat disorders, such as cleft palates, allergies, and sinus disorders. Respiratory nurses provide care to patients with respiratory disorders such as asthma, tuberculosis, and cystic fibrosis. Urology nurses care for patients with disorders of the kidneys, urinary tract, and male reproductive organs, including infections, kidney and bladder stones and cancers. Clinical nurse specialists provide direct patient care and expert consultations in one of many nursing specialties, such as psychiatric mental health. Nurse anesthetists provide anesthesia and related care before and after surgical, therapeutic, diagnostic, and obstetrical procedures. Nurse midwives provide primary care to women, including gynecological exams, family planning advice, prenatal care, assistance in labor and delivery and neonatal care. Nurse practitioners serve as primary and specialty care providers, providing a blend of nursing and healthcare services to patients and families. Forensics nurses participate in the scientific investigation and treatment of abuse victims, violence, criminal activity, and traumatic accident. Infection control nurses identify, track and control infectious outbreaks in healthcare facilities and develop programs for outbreak prevention and response to biological terrorism. Nurse educators plan, develop, implement and evaluate educational programs and curricula for the professional development of student nurses and RNs. Nurse informaticists manage and communicate nursing data and information to improve decision-making by consumers, patients, nurses and other healthcare providers. Some websites from careercornerstone.org/nurse/nurse.htm. aacn.ncha.edu, American Association of Colleges of Nursing. AAFP.org, Commission on Collegiate Nursing Education. NACNS.org, National Association of Clinical Nurse Specialists. NLNAC.org, National League for Nursing Accreditation Commission. NursingWorld.org, American Nurses Association. Stats.bls.gov, Bureau of Labor Statistics. Chapter 3. Nursing websites at DMOZ ODP. Nursing profession websites at dmoz-odp.org/health/nursing. Subcategories. Specialties. Care plans. Evidence-based nursing. Organizations. References. Students. Volunteer opportunities. Nursing assistant profession websites. angelfire.com/code2/cnaworld/index.html, CNA World, a site for certified nurse aides. angelfire.com/il2/cnaweb/index.html, CNA Web, this site has information about diseases, procedures, and other items of interest for nursing assistants. health.groups.yahoo.com/group/nursing assistant, nursing assistant, discussion group to offer support, shared ideas and concerns and humor. Indeed.com/forum/job/certified nursing assistant.html, certified nursing assistants forum, offers a discussion board, links, polls, and news. Members.tripod.com/tilde_CNA_munchkin/sherry.htm, certified nurse assistant, who we are, includes a message board, articles written by CNAs and documentation for use in study. Nursingassistants.net, nursing assistant resources on the web, online resource for nursing assistants and others interested in long-term care. Nursing websites at dmoz-odp.org/health/nursing. Subcategories. Specialties. Care plans. Education. Employment. Evidence-based nursing. Organizations. History. Humor. References. Resources. Students. Volunteer opportunities. Nurse specialty websites at dmoz-odp.org/health/nursing/specialties. Subcategories. United Kingdom. Anesthesia. Community health. Critical care. Emergency. Geriatrics. Informatics. Management. Midwifery. Neonatal. Nephrology. Neuroscience. Nursing assistants. Obstetrics and gynecology. Oncology. Palliative care. Parish. Pediatrics. Perioperative nursing. Practitioners. Psychiatric. Rehabilitation. Research. School nursing. Telephone triage. Transplantation. Wound care. Careplans.com, Care Plans, addresses the entire nursing care planning process and provides a library, chat room, and forums. LTCSbooks.com, LTCS Books Inc., sample nursing care plans and care plan books with CDs. rnCentral.com/careplans/contents.html. Nurse employment websites. Angelfire.com/fl2/hospital jobs, nursing jobs magazine, career and recruiting articles for nurses seeking employment nationwide, including free interview and resume assistance. Nurse.tv, travel nurse across America, includes frequently asked questions, application form, list of benefits, jobs database, and recruiter accounts. NursingTimes.net, Nursing Times, online version of UK weekly journal for nurses, including job postings and career information. UltimateNurse.com, UltimateNurse.com, news, resources, and links and jobs. Nurse evidence-based websites. pit.edu/afshome/s/u/super1/public/html/lecture/lec29661/index.htm. JoannaBriggs.org, Joanna Briggs Institute, offers a variety of evidence-based nursing resources, including membership information, a notice board, best practice information sheets, nursing procedure manuals and systematic reviews of nursing care. NursingKnowledge.org, Nursing Knowledge International, Sigma Theta Tau subsidiary, offers continuing education, evidence-based practice coursework, research, nursing conferences, and Sigma Theta Tau gifts and apparel. rnao.org/best practices, RNAO, Nursing Best Practice Guidelines. The Registered Nurses Association of Ontario presents guidelines, worksheets, and FAQ, with suggestions for implementation and a request form for proposals. Nurse history websites. enw.org/1895_nursing.htm, and 1895 Look at Nursing, excerpt from Ambulance Work and Nursing provides an enlightening look at the nursing environment of the day. AN.org, American Association for the History of Nursing, fosters the importance of history in guiding the future of nursing. Angelfire.com/fl/eeirens fairytales/nursing decline history.html. faculty.mc3.edu/rbenfiel/ner109/ner109 nursing history/sld001.htm. historymatters.gmu.edu/d/60, Beyond Bedpans, the life of a late 19th century young nurse. nursing.virginia.edu/research/cnhi, the Eleanor Crowder Bjoring Center for Nursing Historical Inquiry, established in 1991 at the University of Virginia for the preservation of the history of nursing. vlib.us/medical/mamh/myaunt.htm, My Aunt, My Hero, the story of Helen Fairchild, RN, a nurse in Flanders during the Battle of Passchendaele 1917. vlib.us/medical/canadian/cnurse.htm, My Beloved Poilus, Letters from France from 1914 written by a Canadian nurse. dig2.homestead.com/index.html, Nurses' Uniforms Past and Present, provides a growing image gallery of nurses' uniforms from the 30s to the present. Forms.msvu.ca/library/tutorial/nhdp/index.htm, Nursing History Digitization Project, a collection of photographs and documents from nursing schools, pertaining to the history of nursing education in Nova Scotia, Canada. NursePostcard.com, Zwerdling Nursing Archives, some very unique historic art and postcards of nursing, medical and health care. Nurse humor websites. enw.org/humor.htm, Emergency Nursing World, humorous look at emergency care. angelfire.com/wa/nursejokes/index.html, Nurse Jokes, hosted by nurses, site accepts medical Hummer contributions. infojunkie.info/tinyr/limericks2.html, nursing and medical limericks, rhymes and true stories collected and written by Betty and Cassano RN. jocularity.com, nursing humor on, the nurse-friendly, nursing humor resource and nurse email directory, provides registry for student nurses, LPNs and RNs. nursingfun.com, nursingfun.com, nursing links, medical graphics, jokes and contests. niztoon.com, Niztoon nursing humor cartoons, nursing and health professional cartoon satire dealing with low staffing, managed care, patient advocacy and hospital care. realnurse.net/humor, Murphy's Nurses, Murphy's Law as submitted from the newsgroup Science MED Nursing. Nurse reference websites. manualsweb.com/nursing.htm, nursing dosage calculators, offers drug calculators including mcg/kg/min, drip rates, body surface area and metric conversions and tutorials. nursespdr.com, Nurses PDR Resource Center, includes monthly alerts, changes and new drug releases. nursingethics.ca, Nursing Ethics, index of Canadian and international resources, including organizations, codes of ethics, selected articles, and forum. Nurse resources websites at dmoz-odp.org/health/nursing/resources. Subcategories. Chats and forums. Personal pages. Web rings. Directories. References. allnurses.com, allnurses.com, health links, job listings, live chat and a discussion board. bethboynton.com, Confident Voices in Healthcare. Beth Boynton, RN, MS is a nurse consultant specializing in communication and conflict. currentnursing.com, Current Nursing, site containing nursing theories and reviews. cybernurse.com, cybernurse.com, a resource site for nurses including professional development and clinical information. exceptionalnurse.com, Exceptional Nurse, for nurses and students with disabilities. medscape.com/nurses, Medscape Nursing, news, CE and conference center and discussions. nurse.com, Nursing Spectrum, education resources, job search and relocation information and a discussion area. nursecentral.com.au, Nurse Central, Australian nursing portal with news, resources, links, and forum discussions specifically for Australian and near regions nurses. nurseslounge.com, Nurses Lounge, a professional network for nurses where you can create a personal profile, view our online magazines, detail job search, post journals, forum discussions, upload videos, connect with other local nurses. nursingcenter.com, Nursing Center, offers access to journals, continuing education activities, career information, and discussion groups. nursingnotes.co.uk, Nursing Notes, resource, blog, and toolkit for healthcare professionals in the UK. nursingtimes.net, Nursing Times, a magazine aimed at healthcare professionals in the UK. rcni.com, RCNI, the Royal College of Nurses Information Archive provides a vast array of information of a multitude of sources. rncentral.com, RN Central, offers resources, links, article library, and a forum. scrubsmag.com, Scrubs Magazine, the Nurse's Guide to Good Living. Scrubs Magazine is the guide to good living for nurses in each stage of their career. thenursestation.com, The Nurse Station, a blog created by a nurse for nurses. Chapter 4. Nurse Resources. Nursing Journal Info. There are lots of nursing journals. Some have job ads in them. Refer to the section elsewhere in this book called Lists of Medical/Science Journal Websites. Look through those lists for journals relevant to you. Cochrane.org/reviews, research summaries. freemedicaljournals.com. highwire.stanford.edu, Journals oxfordjournals.org, journals.elsevierhealth.com, lww.com, sagepub.com, tcns.org/journal, Transcultural Nursing Society Journal, tcn.sagepub.com, Journal of Transcultural Nursing, afip.org/department/legalmed/lmof.html, Legal Medicine, the Journal of Nursing Risk Management, natco1.org/prof_development/progress_transplantation.htm, Progress in Transplantation, jopan.org, Journal of Perianesthesia Nursing, wocn.org, Journal of Wound Ostomy and Continence Nursing, ajnonline.com, American Journal of Nursing, jcn.co.uk, Journal of Community Nursing, journal.hsmc.org/ijnidd/index.asp, International Journal of Nursing in Intellectual and Developmental Disabilities, an.org, Journal of Neuroscience Nursing, ajj.com, Nursing Economic Dollar, the Journal for Healthcare Leaders, ourn.org, blackwellppublishing.com, Journal of Clinical Nursing, dnanurse.org, Journal of Advanced Nursing.com, Journal of Nursing Scholarship.org, nephrologynursing.net, nurseweek.com, nursingzociety.org, nursing-standard.co.uk, ons.org, Oncology Nursing Forum, pediatricnursing.net, rnweb.com, wileyeurope.com, Research in Nursing and Health, Journal of Christian Nursing, POG 1650, Downers Grove, Illinois 60515-1650, jcn at 4press.com, ncf.jcn.org, Journal of Nursing Administration, Downville Pike, RT3, Box 20, Hagerstown, Maryland 21740, 800-638-3030, Lippincott-Raven Publishers, POG 1590, Hagerstown, Maryland 21741, 800-777-2295, 800-638-3030, Cancer Nursing, Computers in Nursing, Home Healthcare Nurse, Journal of Nursing Administration, Journal of Nursing Staff Development, Journal of Obstetric, Gynecologic, and Neonatal Nursing, Marion Publishers Incorporated, 2900 Horizon Drive, POB 61556, King of Prussia, Pennsylvania 19406-0956, 800-355-1088, 610-278-1400, otedit@marion.com, advanceweb.com, marion.com, Advance for Nurse Practitioners, Minority Nurse Newsletter, Tucker Pub, POG 580, Lisle, Illinois 60532, 630-969-3809, Mosby Incorporated, 11830 West Line Industrial Drive, St. Louis, Missouri 63146, 800-453-4351, 800-325-4177, 314-872-8370, mosby.com/mosby/periodicals. Several nursing journals and books. Journal of Emergency Nursing, Journal of Pediatric Healthcare, Journal of Wound, Ostomy, and Continence Nursing, Nursing Outlook, Springhouse Corp., 1111 Bethlehem Pike, POG 908, Springhouse, Pennsylvania 19477-0908, 800-633-2648, 800-783-4903, springnet.com. Free job service listing. The Nursing Career Directory. Several nursing journals. Nurse Practitioner Journal. Nursing and Nursing Management. Today's Surgical Nurse Magazine. Slack Incorporated. 6900 Grove Road, Thoroughfare, New Jersey 08086. Slackinc.com. Oncology Nursing Websites. ISNCC.org, International Society of Nurses in Cancer Care. ONS.org, Oncology Nursing Society. ASSOFIC.org, Association Française d'Infirmières de Cancerologie. French Association of Oncology Nurses. AFON.org, Association of Pediatric Hematology/Oncology Nurses. US, Canada and other countries. Banon.org.uk, British Association of Head and Neck Oncology Nurses. cnsa.org.au, Cancer Nurses Society of Australia. EANS.ee, Easti Oncologia. Estonian Oncology Nursing Society. CancerNurse.eu, European Oncology Nursing Society. itonf.com, International Thoracic Oncology Nursing Forum. Macmillan.org.uk, Macmillan Cancer Relief. Charity providing information, advice, and support in the UK. Over 3,700 Macmillan nurse posts across the UK. co.org, Sociedad Española de Enfermería Oncológica. sgno.org, Society of Gynecologic Nurse Oncologists. Cancervard.se, Swedish Cancer Nurses Society. ucons.org, UK Oncology Nursing Society. vvro.be, Vereniging voor Verpleegkundigen Radiotherapy and Oncology. Oncology, Belgian Association for Nurses in Radiotherapy. inctr.org/program/oncology-nursing, Inctra Oncology Nursing. Program. Oncology Nursing Program, International Network for Cancer Treatment and Research. Oncology Nursing Journals. CancerNursingOnline.com, Cancer Nursing. A bi-monthly journal. CancerNursingPractice.rcnpublishing.co.uk, Cancer Nursing Practice. RCN Publishing. ons.org/publication/cjon, Clinical Journal of Oncology Nursing. EJOncologyNursing.com, European Journal of Oncology Nursing. Official Journal of the European Oncology Nursing Society. jpo.sagepub.com, Journal of Pediatric Oncology Nursing. AdvancedPractitioner.com, Journal of the Advanced Practitioner in Oncology, Harborside Press. ons.org/publication/onf, Oncology Nursing Forum. Oncology Nursing Society. SeminarsOncologyNursing.com, Seminars in Oncology Nursing. Elsevier.